Ladies and gentlemen, good afternoon. I am Dr. Mengyu Wu from Changgung Memorial Hospital in Taiwan. Today, I will be presenting my research entitled, Enhancing Surgical Education for Novice Learners, a novel 3D printed vessel ligation simulator, providing objective metric assessments of knot tying competency. Let me introduce my team members from CG Ziyuan Yao and Jianren Lin. Both of them have made substantial contributions to this work. Background: tying surgical knots securely is an essential skill for all surgeons. From the perspective of a cardiovascular surgeon, the hallmark of expert competency in this skill is the ability to repair or ligate a pressurized blood vessel without significant blood leakage. As shown in the video, the suture line on the aortic graft must be secure enough to prevent intravascular blood from gushing out of the repaired or ligated site. In other words, a secure knot can resist intravascular pressure and achieve hemostasis. The surgeon also ties knots gently and fluently to avoid tearing the tied tissue or the suture. Actually, knot security directly contributes to patient safety. In a large study investigating the causes of reoperation for postoperative mediastinal bleeding in 10,070 adult cardiac patients, suture line bleeding was found in approximately 30% of the cohort. In another similar study examining the impact of reoperation for excessive mediastinal bleeding on in-hospital mortality in adult cardiac patients, the need for reoperation was shown to significantly increase mortality. Although knot security is the most critical issue of surgical knot tying, it cannot be objectively taught or assessed by existing knot tying simulators. Therefore, there is an unmet need in simulation training for surgical education. Summary of work. First, we needed to design and create a simulator that mimics knot tying for vessel ligation in clinical practice. The competency of this skill is evaluated in three aspects: the ability of pressure resistance for knot security, time to complete a task for fluency, and vertical displacement of the knot during vessel ligation for gentleness. We conducted a mixed method study from August 2021 to September 2022. The first stage involved creating the major domains of the curriculum. In the second stage, we recruited experts and novices to experience the curriculum. 6 attending surgeons and 30 Year 5 medical students were recruited for simulator evaluation. In the third stage, their performance on the simulator, as well as their perceptions of its validity and benefits in teaching and learning surgical knot tying, were collected and analyzed. We used the Fitz and Posner model of skill acquisition, along with the flipped classroom approach, to design our curriculum. An e-learning platform was developed to provide foundational knowledge of surgical knot tying, enabling learners to engage in pre-class active learning during the cognitive phase. In the associative phase, learners attended a 3-hour hands-on class to translate this knowledge into proper hand movements. They were encouraged to practice repeatedly after class to progress into the autonomous phase. The e-learning platform remains accessible to all learners, serving as a permanent scaffold for learning support. Summary of results. The simulator received high validity scores from the surgeons, with an average of 4.5 for face validity and 4.77 for content validity. By the end of the hands-on class, 80% of the medical students had achieved expert-level competency in the security and gentleness of their surgical knot tying techniques. However, their knot tying fluency remained significantly inferior compared to the experts. The simulator was unanimously deemed beneficial by the students, who particularly appreciated its realistic environment and immediate objective feedback. The feedback mechanism motivated them to practice repeatedly, until satisfactory results were achieved. And this leads to significant improvements in their confidence and skill mastery. Discussion and conclusion. This novel simulator successfully addresses a gap in simulation-based education for surgical knot tying skills, and offering a clinically relevant method to teach and assess the competency of surgical knot tying. Unlike typical skill training studies, we adopted a mixed method design that incorporates both quantitative and qualitative data from participants. This approach allows us, as surgical educators, to gather multi-perspective feedback, enabling us to assess whether the simulator meets both the cognitive and psychological needs of trainers and trainees during the educational experience. Thank you for your attention. I would like to give special thanks to Professor Monroux, who provided valuable guidance in revising this work. The introduction video of the simulator follows this slide and can be played at your discretion. Hi. I am Dr. Mengyu Wu, you may call me Kate. I'm a cardiac surgeon and a physician educator in Taiwan. Today, I'll introduce a novel knot tying training platform to you, the Surge Tie. Tying a secure knot without excessive tissue traction is the common learning objective in curriculums of surgical knot tying. With my engineering partner, the SurgeMate company, we tried to make Surge Tie the best surgical knot tying platform to achieve the learning objective. Surge Tie is 3D printed and has 4 merits in hands-on training. First, small and easy to carry. Second, tasks with varying degrees of difficulty. Third, assessing the learning outcomes scientifically. And last, it can be used for distance education. Let me show you how to tie a sliding knot to ligate the small silicone tube on Surge Tie. Use a 3-0 silk thread to tie 10 half knots with one-hand method. The maximal displacement of the tube during my operation is about 1 centimeter upward. The displacement can be converted to a force of about 50 gram weight, smaller than the force to pick up an iPod Touch. Okay, after the task is completed, I pushed the green button to activate an air compressor inside, to drive an airflow into the proximal end of the vessel. I passed the test because the pressure could stay at a value exceeding 0. According to the Pascal's principle, this means my knot prevents air leaks and secure. Okay, hope you will like the smart training box for surgical knot tying. You can learn more about us later. Bye-bye.